Hello, I am Urologist Ömür Erdem Akkaya. Today I will do a short presentation on cholesterol drugs, their side effects, and whether they will cause problems with sexuality. I will also briefly talk about non-anabolic steroids. Statin group cholesterol drugs are drugs that are used by millions of people around the world in the prevention of cardiovascular diseases, and in the treatment of existing cardiovascular disease, and they are used for life when started. These drugs are a very important source of revenue for pharmaceutical companies. And great studies are being done on these drugs. These drugs have proven important effects on cardiovascular health. What side effects do these drugs have? The most common side effects of these drugs are muscle-related problems, inflammatory myopathy, increased risk of diabetes, increased risk of cataracts, increased liver functions, impaired cognitive functions such as thinking, decreased testosterone and erectile dysfunction. Studies showing such side effects are generally what we call observational studies. There are also randomized controlled studies. Their degree of proof is much higher. The treatment guidelines said that these side effects in randomized controlled studies are insignificant, that they can be ignored, and that these drugs should be used because the benefit is much more than the harm. Our topic is erectile dysfunction. Do these drugs cause erectile dysfunction? There are studies conducted in the lab environment. You can see the latest study conducted in Turkey, showing that it causes erectile dysfunction. But when we look at clinical studies, some studies say it causes erectile dysfunction, and some studies say it doesn't. There is something a little confusing here. However, the common result of all studies is that it reduces free testosterone and total testosterone. Because it disrupts cholesterol metabolism and testosterone is produced from cholesterol. At the same time, it reduces the amount of coenzyme Q, which is the transport protein in the mitochondria, which we call the body's energy stoves, and it can cause problems related to this issue. While using these drugs, patients may experience erectile dysfunction if their erection is not strong, as these patients often have other diseases as well. But there is no such thing as it is going to happen. However, I would like to talk about corticosteroids. These drugs are also widely used in clinics. It can be used for muscle pain, joint pain, lumbar hernia, and immunologic and allergic problems. Here, too, we can say that corticosteroids, that is, steroids released from the adrenal gland, are the stress hormones of the body. In an environment of stress, when the body needs to protect itself, the body increases them. Increasing these causes a decrease in sex hormones, FSH, LH, testosterone, and estrogen. For example, if the patient has an allergic problem, or has low back pain or lumbar hernia, the patient has a steroid treatment. Prednisolone is the most well-known substance on the market. It's very widely used. A few weeks later, the patient may come to me with a complaint of erectile dysfunction. Sometimes the patient has difficulty even remembering this. Indeed, if the patient does not continue on steroids, he can recover in a short time with some medical treatment. I mention this because it is one of the drugs that should be considered and cause erectile dysfunction. Thanks for listening, best regards.